Hi, my name's Matthew. I'm a senior physiotherapist at myPhysioSA, and I'm currently working in partnership with the International Spine Centre in Wakefield Street Clinic and also in the Hills Integrated Pain Team in one of our Mount Barker clinics. This video follows on from the previous video talking about the sensitisation of the nervous system with persistent pain, and what I'm going to talk to you about in this video are some management strategies about how we can try and desensitise that sensitised system. I think there are lots of strategies that are designed to help the individual based on their needs, and I think that's the most important part. So whenever you're thinking about ways to manage persistent pain, it's always important to get physio advice so you can really tailor the program to your individual needs. I think the most important thing is that the body is designed to move, and our tissues and our joints and our nerves, everything is designed to move. And so the most important thing is that it is okay to move, okay? And movement is really important in trying to desensitise the system with persistent pain. So exercise has many benefits. It helps with our physical conditioning and strength. It helps with giving us more energy. It helps with sleep. It helps with our general health and general well-being. So exercise has many positive benefits. The other strategy that can be really helpful is to actually keep a pain diary. And the idea with the pain diary is to really, hone in on what is actually the main issues for you and what's contributing to your persistent pain issue, so that you're actually better able to communicate that and to develop specific goals that you want to actually achieve when you come into to have physiotherapy. But I think the most important strategy is what we call pacing. And there's a lot of research out there now that really supports pacing strategies as an effective treatment technique for managing persistent pain. And essentially what we mean by pacing is establishing a goal that you want to improve. So it might be you want to be able to walk for 30 minutes with the dogs, and at the moment you can't do that. So you first need to establish that goal. And the next thing is to establish a baseline. So a baseline can be taken by averaging out what you can do. So you may only be able to do 15 minutes on one day and 10 minutes on another day. So you can average that out, and then you want to reduce that level by 20%. And then that's the starting level for you to try and do that activity. And then it's a matter of actually completing that activity every day so that you can start to build up a tolerance to that activity. And the key is that you don't want to do more on days that you feel better or do less on days that you don't feel as good. It's really about trying to maintain that same level of activity on every day. And as you get better at that, the next step is to then gradually increase the amount that you're doing. And that would be just by adding about 10% to that exercise per week. The key thing we want to avoid with pacing strategies is to end up in a bit of a boom-bust cycle where you do exercise and then you flare up and feel like the pain gets worse, and then you have a period of inactivity. But in reality, when we're actually doing exercise for persistent pain, it's actually normal to have a little bit of soreness and a little bit of pain in muscles, because we're actually getting you to use those muscles again. Well, I appreciate you listening to my talk about persistent pain and management strategies. I really enjoy trying to help people achieve their goals and to get back to the things that they want to do. So if you need any help, please feel free to get in touch.